Good morning. Thanks so much for joining us today for the next Aging at Altitude presentation. Today's topic is spine, muscle, and joint care. My name is Al Manzi. I'm the president and CEO for Prairie Mountain Media and also the publisher for the Daily Camera and the Times Call. Today, we're so fortunate to be joined by one of Boulder's finest doctors. He's been a frequent presenter at our Aging at Altitude seminars. Dr. Cliff Gronseth, owner of Spine West in Boulder. Dr. Gronseth today will present for about 40 minutes, and afterwards we'll have hopefully a lively question and answer session, and you can use your chat or your question and answer feature to ask your questions anytime during the presentation, and I'll moderate the session at the end. As a reminder, please visit our Aging at Altitude website to do a virtual tour of our partners and their services. Please join me in welcoming Dr. Cliff Gronseth.
Hi. Hi. Okay, I'm online. Today's topic is spine, muscle, and joint care. And I will lead you through a lot of information, hopefully something that you'll pick up for tips and pearls and things maybe you don't want to know about. So it's quite a large concept of what we're going to talk about, which is it's basically the entire musculoskeletal system. And we will be covering the spine, the joints, and of course the muscles, as we talked about. So as we there we go. This relates to our beautiful spring weather today. The whole concept is to try to keep you healthy and functional throughout your life and throughout your career here, so that we can avoid injury and prevent having to see people like me. Now, I'm a specialist. I'm a physiatrist, which is a medical doctor, but my specialty is what I call the box, external medicine. I know all about the insides of the box, the hearts, lungs, livers, etc. But we specialize in trying to keep the box functional. Now, we know that every box has a unique story. All of you have your own history and background for who you are and where you are today. The key thing about that is that over time, we get more and more fragile. And we get kicked, dropped, and abused through life, and it ain't always easy. So the key thing, the take-home message is, let's try to keep you as functional as possible, but at the same time, protect you from injury. So I'm going to cover a little bit about the lifespan from mid-cycle on. As you know, the circle of life has its path. And this whole lecture series is really based on the second half of this curve. Now, I'm going to go through some of the normal areas of what things used to look like, and then some things that happen as we season, so to speak. I'll start with the spine. Everybody gets back pain. If you don't have back pain, if you've never had it, then you're beating the odds, because it will eventually hit you. And the reason is there's so many parts to the spine that can break down and cause problems. So it's a very finely tuned machine. It's very complicated. This is a straight on X-ray of a spine. This is a normal MRI. So you can see that the spine has these little square gray bones to them, the vertebral bodies, and they're separated by these lovely little oval shaped white discs. Now, that's what a spine should look like when you're 20 years old. This is what happens as we get wiser and more mature. We start to lose some of the hydration or the water inside of the disc, and then you start to get arthritis and the spine starts to slip. It starts to get malaligned. As we season even more, the body will, let me get there, the body really starts to melt, And the main things that go are the discs. You can see here, these discs have now flattened out. This is not a disease, unless you call aging a disease. This is simply life. The problem is that as we mature, as we age, the disc and the bones will start to degenerate. The big thing is it's not dangerous until it starts to get the nerves. You can see right in here, these little fibers coming through here. And if it pinches right here and you start to affect their spinal nerves, that's a big deal. We always protect the nerves. You can end up bent forward because the bones actually start to break over time as well with osteoporosis. And we'll talk about that here in a second. So let's talk a little bit about bone health first and foremost, because that has the most to do with the spine. For those that don't know, osteoporosis is basically a loss of bone strength. We have our peak bone strength between the ages of 30 and 40. And males tend to have a little bit stronger bones than females. Females really take a hit on their bone density during menopause right here. And that's the big dip why a lot of women end up with the fractures more than men, simply because the change in hormones really loses the bone density, and then it continues on in a slow gradual decline. And like I said, osteoporosis is painless. My analogy for osteoporosis is almost like termites in wood. Normal bone, you can see here, is colored in white, and then with little dark spaces, little holes in the bone. As you start to lose some of the integrity of the bone, you get a little bit more holes in it. Down here is where you get osteoporosis, and this is where this is less than 5% of 30 to 40-year-old women, in a sense, is defined as osteoporosis. It's 2.5 standard deviations from the peak bone density. But you can see the holes in the bone here, and then here you can see even more termite-eaten bone, and it's just a few strands of bone that's holding you together. This is what it looks like when you cross-section a vertebral body. This is normal bone right here. You can see it's got fairly good structure. Here, you can see osteoporosis. You can see it looks moth-eaten, termite-eaten, and it doesn't take much to overload those systems when you, as you mature or if you fall. Now, the thing about osteoporosis is bone responds to pressure. Astronauts get osteoporosis because they don't have any load on their system. It's one of the main limiting factors for prolonged space travel is the bones start to whittle away. So how do you fix that? How do you prevent it? Well, it's all about weight bearing. It's about stressing the body. So things like walking, weightlifting, anything that puts pressure and impulse pressure on the spine is helpful. I'm a big advocate for walking with hiking poles as well. It provides some stability, might catch you from falling, and it also works the arms and makes you stronger there. The other thing that you can do to try to increase or maintain your bone strength is to perhaps put a little bit of extra load on here. Not a lot, but you might consider wearing a little backpack if you're a walker, and put a can of soup or a gallon of water, or you just slowly build up the pressure, wear the backpack, and that will transfer the weight from your shoulders down through the spine and provide some tension or some pressure on the bones so that they actually maintain their strength and perhaps even build strength. Uh, the the other thing that you can do to protect your spine is to get abs of steel. Okay, now it's not just the six pack that we're talking about. It's about the oblique or the deep core muscles that wrap around your body, attached to the vertebral bodies, to the spine itself, and they stabilize the spine, kind of like strings on a tent, will keep the center poles from wiggling around too much. So the stronger your abs, the more protected your back will be. How do you do that? Well, you find the exercises that are most amenable to you, and those include um, basic basic floor exercises. You don't need anything fancy to build strength. And you want to find those types of things that allow you some juice from the squeeze, is what I say. Things that you really feel make a difference in stressing the muscle. You may need some guidance on this before you just start doing exercises hilly-nilly, because that may cause some problems. Now, the other thing that you try to do is flexibility. Okay, people always ask about yoga and et cetera. Is that good for you? It can be good. Yoga can be excellent. But if it's not done right, you end up stressing the spine more than you should. So you definitely want guidance if you're going to do yoga, or do it very gently. For example, you notice that this young woman has a bend right at the corner there, and she's repetitively bending in one place, even though she looks hyper flexible. This is not a nice, smooth, even curve of the bend, and this can wear out just different segments. Maybe safer to start with something a little bit more gentle. I'm a big fan of Tai Chi. There's much research to support the concept that Tai Chi is helpful for preventing injuries, falls, etc. Let's talk about joints. Okay, so joint pain. The main one that people complain of are knees and hips. So we'll start with the knees. So as we mature, the body will slowly start to degenerate. And let me get get my slide to move forward here. And yep, not moving forward. Let me just see if I can. There it goes. There it goes. Got a little lag here. So the body the bones have an end cap of cartilage at right on the distal end, and that's basically almost like Teflon coating that covers the joints, the bones. As we mature, you start to get little pits and grooves inside of the cartilage, kind of like the treads that wear out in your tires. You might also get some rust spots, some little bone spurs and things like that, which will degrade. Now, there's a staging that we use in medicine to describe the degree of arthritis. You can have a basically normal looking knee, but it's a little bit wear and tear. You might start to get little fissures in the cartilage or tears in the meniscus. That progresses to where you're really thinning out the cartilage, and then in stage 4, you end up with literally bone on bone type of configuration. Now, if you look at the cells, this image is nice, healthy cartilage. It looks beautifully uniform. It's got a pretty purple color. It doesn't really, this is of course stained, but you see how nice and smooth the edge is, and it's just a nice, dense cartilage. Now, if you look at a fairly arthritic piece of cartilage under a microscope, it looks more like melted ice cream or a watercolor project. You have fissures, you start to lose some of the integrity of the surface, and it just starts to wear down. All right, it's not a disease. It's really just based on your genetics, the load you put on your body, especially in your youth, etc. If you're playing basketball and a jumper, you might accelerate that degeneration, but there's a very strong genetic component to it. This is a typical x-ray that you might see of the knee. You can see a nice gap. It almost looks like this bone is floating. This is the kneecap or the patella. It's floating on top of the end of the femur, and it looks great. And this is an x-ray of a knee, and there's a little bit of narrowing going on, but not a lot. There's still plenty of kind of gap between the bones, which indicates that the cartilage is good. However, you might still have knee pain. You not see it with the x-ray. An MRI may show that the bone is actually starting to get swollen or bruised because of it. And we even use ultrasound to diagnose cartilage defects. You can see this little white rim right here, which is the femur, and it's overlain with a little black layer that's fairly uniform thickness. But if you look right here, there's a little divot in the cartilage. And so people might have normal looking x-rays, and yet they have knee pain that because those little fissures in the cartilage that is starting to wear out. Now, the same can happen with the hip joint. The hip is a fairly deep socket, and a lot of the load of the body runs right up through the 12 o'clock position of the hip joint right here. This is where your lower extremities meet your upper body, right through this point here, as opposed to this part of the joint on the inside here. And if you look at the x-rays, you can see it's a nice deep socket. You start to get a little bit of bone spurring that happens over time. And then you get to the point where there's nearly complete collapse. You can see the bone here has gotten hard, thickened. This is an end stage hip. Unfortunately, this is likely going to be a hip replacement type of procedure more than any type of magic cure. This just looks painful to visualize. This hip still looks pretty good. You can still see a little bit of gap between the femoral head, etc. Again, end stage hip, there's no space between the bones. It's white bones, which means it's hardened. It's got a lot of little bone spurs and everything else. That's a painful hip. The same thing can happen with the shoulder, but a little bit less so, simply because it does not take as much load. This is an x-ray through the shoulder joint, and you can see a nice little gap as if the bone is floating. The humerus is floating on top of the shoulder bone, which is the scapula. And then you can see this one where you've got complete loss of gap, no spacing between the bones, bone spurs, etc. Just a grade 4 shoulder. This one also hurts. The same thing can happen in the hands, any joint in the body. Over time, it will start to just kind of thin out and degenerate. Now, what do you do about it? Well, what we do is we recommend relative rest. So the concept is offload the joint that is bothering you. Be respectful of the pain. Pool therapy or pool exercise is great because it basically unweights you, takes the load off that body part, and allows you to stay fit without having to do too much stress on the joint. If you're a walker, etc., it's good to do gentle exercises, stretching exercises that allow isometric strengthening, which is basically you're not necessarily doing a lot of repetitive motion, but you're simply keeping the joint in a very static position, and you strengthen the muscles without having to repetitively stress them so they don't wear out as fast. And the strengthening of the muscles will, like the abdominal muscles, support that joint and continue function. And the other way is to keep moving. Even though it seems contraindicated or the opposite of what you'd expect, but they've shown that exercise actually helps arthritis, or at least arthritis pain. The cartilage gets its nutrients by the pressure, the load on them, and they just kind of absorb some of the nutrients in the joint juice, so to speak, the synovial fluid, kind of like a sponge might absorb water off of a countertop. It does not have the cartilage does not have a lot of blood supply in itself. So it requires this kind of constant little bit of a pressure to absorb the nutrients. And the other thing that you can do is, of course, I won't belabor this point, it's pretty self-evident. Weight loss, taking the load off of the joints is always a good thing. All right, now let's move on and let's talk a little bit about muscles. Now, the muscles are, let me go get this to move forward here. So we'll talk about the muscles. All right, so just a little education about muscles. All right, so Arnold has just as many muscle cells as this young man. The number of cells are equal. It's just that Arnold happens to have very plump cells, as opposed to this man who probably has kind of skinny, weeny little cells, but the number of cells are the same. Now, there are two main types of muscle cells. You've got the aerobic long distance type, non-fatiguing cells that you see in marathon runners. And then you've got these power muscles. And these are called type 1 muscle fibers and type 2 muscle fibers. What happens as we age is we lose the type 2 muscle fibers. So there's a preferential decline or atrophy or loss of the type 2 power muscles as we mature. And so you'll start to get what's called sarcopenia, which means loss of muscle or, kind of decreased muscle. And it's no fault of your own, but muscle does respond, kind of like bones, to pressure. So the key is to try to maintain your strength and your type 2 muscle fibers, because you'll keep your type 1 fibers uh, right into the grave there. But the type 2 is what dissolves away. And what you want to do is try to keep your legs as strong as you can, because those are the power muscles. The power muscles allow you to get off a toilet, climb the stairs. So the key is, like I said, is to try to get the muscles as strong as you possibly can. And for that, you want to keep your legs strong, so you can get on and off the toilet well and climb stairs. Now you can use these at your home as exercise equipment. Instead of getting off the toilet once, get off 10 times and see how well how strong you can make your thighs. You can go up and down the stairs a few times, holding on to the railing, depending on your frailty, to try to keep your legs as strong as you can. For your upper extremities, what you want to do is try to find use heavy weights as much as possible. The rule of thumb is try to get 10 to 15 repetitions of your exercise, and then you have to put the weight down. If you're doing 1 pound weight for 1,000 repetitions, it's not nearly as good as doing 1,000 pounds once. Okay, so it's all about stressing those muscles, because it's those type 2 fibers, which is what we lose, and those cell fibers respond to load. And if you're just doing a light load and a lot of repetitive things, it's not going to maintain those type 2 fibers. The aerobics, of course, is always good. Those are the type 1 fibers that I was talking about. If you do walk or use a treadmill, especially the treadmill, if you put it on a little bit of an incline, so you're leaning forward, put a little bit more stress on it, then you can get some little bit of cardio along with working out the muscles. But you want to be extra careful that you are safe. Okay, so if you're starting a new exercise program, please, please, please get evaluated by somebody to make sure that it's safe, because you may have hidden time bombs. This is actually a CT scan of somebody's spine, which shows some degeneration, but what you also see is there is calcium buildup inside of the aorta, which is the main blood supply to the body. And that implies that this person has cardiovascular disease that can also be silent until it blows. Now, it's all about balance, okay? We don't expect you to be able to balance on your toes. It's all about doing the exercises that provide you some enjoyment, but also some juice from the squeeze. Again, some little bit of general, mix it up a little bit. The key is to get your brain to connect with your nerves. So for balance training, it's always good to practice standing on one leg. You can use the countertop as a stabilizer or a chair or something so that you do not fall while you're standing on one leg. But like a ballerina learns to dance on point, that takes a lot of practice, and it basically connects her brain to her toe. And you need to connect your brain to your feet so you're a little bit more stable when you're exercising. Now, I mentioned before, uh, Tai Chi. Tai Chi is wonderful for improving balance. You don't need to do it right. You don't need to take a class per se. It is all about just learning to shift your feet side to side, and maintain some type of movement along with working on gentle balance. So let's review a few things here. So we have covered a lot of material. We've got the spine, we've got the joints, we have the muscles, all of the external things of your body. The key take-home point, however, is to be very respectful of pain. If you feel pain, don't think you can outrun it. Please get it evaluated, because it's not a no pain, no gain situation. Usually the pain is an indication that you're overloading the system, and it should be evaluated. The big take home point is you want to preserve your strength. Okay. You don't want to necessarily do a lot of, easy exercise, walking, gentle biking and things. You really want to try to maintain the type 2 fibers that we talked about, so that you, as you mature into your more wise years, you'll have the power to be independent, to get out of off the bed, off the chair, off the toilet, without needing help. And also the power muscles will provide some stability for you. The other rule of thumb is please keep moving. You want to do the things that allow you both the positive feedback, but we're not designed to be stationary. We were originally hunters and gatherers. And so sitting in front of a computer or sitting in a chair all day is really not our best for the genetics and for aging. The other thing that you really want to do is just enjoy what you do. Have exercises or activities that really seem to give you like I said, the positive feedback, so you're more apt to continue doing them. And because if you start an exercise program, it's oftentimes destined to fail unless you have some backside positive reinforcement. All right, so that's the gist of the lecture today. I put this out there hoping that spring is around the corner and we will see some future happiness. So I'm going to open it up to questions.
Thanks so much, Dr. Gronseth. That was wonderful. You did a great job as usual. So the first question I got today was, is it all right to do low impact exercises if you have lower spine stenosis diagnosis?
Yeah, so the spinal stenosis is it is a condition where the nerves are getting squeezed by the spine because of the degeneration and the narrowing that happens in the channels where the nerves go through the back and the spine and go out into your limbs. Spinal stenosis it can be dangerous, and you have to be very respectful of it. Typically, the pattern for spinal stenosis is pain when you walk that's relieved with sitting, because when you stand up, the spine actually shifts a little bit, and it will crimp the nerves more when you're standing. And if you sit down, they uncrimp or they open up the space a bit. So the rule of thumb again is to be respectful of the pain. With spinal stenosis, it's okay to exercise as long as it's not hurting you. Typically, what you'd want to do is bend a little forward, like a pensive professor. Use the walking poles, like I was talking about, which would encourage you to lean forward, and only walk uphill. Okay, when you walk downhill, you'll lean backwards. So, all kidding aside, if you do walk in the hills and you're walking downhill, lean forward when you do so, because if you start to lean back as you're walking down, it will squeeze the nerves. But we encourage people to continue exercising with spinal stenosis, but be respectful of the pain. Alternatively, if you don't want to hike, bicycling or any type of sitting type of exercise is excellent for spinal stenosis.
Thanks so
And
much.
one other point, there's another type of pain that develops with walking, and that's from cardiovascular disease. And that's when the blood supply to your legs is not enough. When you as you exercise, the muscles require more blood because you're using them. If the plumbing does not allow enough blood to get to the muscles that are demanding oxygen while you exercise, that also can cause pain in your legs, and that's called vascular stenosis, and that's totally different than the nerve stenosis.
Thanks so much. Do you recommend women should get a bone density test after going through menopause? If so, who does these types of tests?
Yes, in my mind, every woman should get, in fact, everybody should get at least one bone density scan, especially post-menopause, because even though we live in a sunny state, and the sunshine will induce vitamin D production in our bodies. We oftentimes protect ourselves with hats and sunscreen and sunblock, etc. And we don't get enough vitamin D to maintain the calcium in our bodies to keep the bones strong, because the body requires calcium in order to keep its strength. The bones are always turning over. They say that every 7 to 9 years, you have a whole new set of bones. There are cells that basically go around like Pac-Man, and they go and they gobble up the bone, and then they have these bricklayer cells that follow them, and those lay down new bone. And so it goes like that. If the Pac-Man eat a lot more than the bricklayers, you don't get as much bone density. You start to lose your bone density over time. And the only way to really tell the strength of your bone is going to be with a bone density test. And that basically involves shooting a little beam of X-ray through your hips, through your spine, and your wrist, and they look to see how much of the X-ray is absorbed, and that determines how dense your bones are. The denser the bones, the more absorption you'll get. If the bones are full of holes, the X-ray beam will shoot right through, and that'll give you a score that tells you where you are on that curve of bone density to determine, do you have good bones? Are you osteopenic, which means that they're starting to get a little thin, or is it osteoporosis? Osteoporosis then sets you up for fractures, either fractures after you fall, or just spontaneous fractures. For example, a lot of hip fractures in the elderly occur before the person even hits the ground. They're walking and they overload the strength of the bone integrity, and that's what causes them to fall, because the strength of the femoral neck is just like balsa wood. It's just moth-eaten. And so getting the bone density as a baseline number to know where you are is very strongly recommended, because there are ways to prevent further bone loss, like we talked about, with exercise, making sure you have enough calcium and vitamin D in your system, etc.
Along the same line, is anyone in Boulder County offering trabecular bone score with a DEXA scan?
Yeah, well, the DEXA scan is, they use both the DEXA scan, and then they have something now based on history called a FRAX score, which is based on your family history and prior fractures, etc. But the gold standard is this DEXA scan. That's usually performed at a hospital. There are I think there were some clinics that provided the DEXA scan, but I think now most of the DEXA scans occur in hospitals or radiology centers.
Thanks. Are there any over-the-counter meds you recommend to decrease osteoporosis in joints?
Well, like I talked about, the biggest two ingredients are the vitamin D and calcium. Now, vitamin D does not build bone in itself. It's the calcium that provides the strength of the bone. Vitamin D just allows the calcium to be absorbed enough in your body so that it actually will get into the bones. If you don't have the vitamin D carrier, so to speak, to absorb that calcium into your blood from your diet, etc., and then have it incorporated into your bone, you won't have as we go back to the Pac-Man and the bricklayer, there won't be any bricks to build strong bone with the osteoblast, because they just don't have the calcium to do that. As far as over-the-counter medications and things, it's really the nutrients or the supplements that are going to be the key factor. The osteoporosis medications that are mainly prescription tend to be bone sparing. They might they usually slow down the osteoclasts, those cells that eat up the bone. So they'll slow those down so that the bricklayer cells have a chance to lay down some new bone behind it. But if the Pac-Man are just eating up the bone faster than the bricklayer cells can lay down new bone, then that's where you get the net loss of things. So there's no over-the-counter medication that will slow down the osteoclasts, these little Pac-Man cells.
Can knee joints be resurfaced rather than replaced in the way the hips can?
Well, yeah, you can. The knee arthritis and the knee replacements are the joint replacement industry is fantastic. It's a real game changer when you need it. And as a physiatrist, we advocate for non-surgical options, but there are times where there's nothing but surgery or replacement, which is going to help you. And the joints, the knee joint has three main joints. It has the joint between the kneecap and the femur, and then it has the inside of the knee and the outside of the knee, where the femur meets the tibia. And depending on what your wear and tear is inside the knee joint will determine what type of replacement you get. Sometimes they'll just do a partial knee replacement, which is probably like the resurfacing type of thing that you talk about. The partial knee replacements are usually not as successful as the total knee replacements. But if you only have one out of the three compartments that it's worn out, it may be helpful to just buy you some time until the threads, or the treads, so to speak, on the other parts of your knee until they wear out and you need a total knee. So you can also use bracing. You can try to offload the worn part of your knee joint by realigning your knee. You can do it from your feet up. You might be able to put a little bit of a arch support into your shoe so that it changes the angle of your foot and the angle of your ankle. It changes the angle of your knee. And so now you're better aligned higher up than just having your knees wear out, almost like if the tires in your car are malaligned and they're going to wear out differentially on the inner or outside of the joints. The treads wear bare non-uniformly.
Thank you. What are your thoughts about Pilates if you have osteoporosis? It seems great at lengthening the upper arms and shoulder strengthening, but there's also a lot of forward bending and twisting, and this person wonders about that.
Pilates is great. I really am a fan of Pilates because it does work on strengthening in a controlled way, especially with the spine, because the spine is oftentimes the most vulnerable vulnerable part when you're exercising, because there's, like I said, there's a lot of moving parts to it. So if you can get one good instruction on Pilates, that's number one. And number two is you can usually do Pilates without the fancy equipment, the reformer and all that. A good teacher should be able to guide you on how to strengthen in a very controlled way and also lengthen the muscles. The idea of Pilates is you isolate the muscles and you really work on them in a very isolated way versus just doing like a big sit-up, for example, which recruits a lot of different muscles, even your hip flexors, which have no relevance to the support of your spine. They're just basically lifting up your body. So the Pilates really is focused on those inner core muscles and trying to isolate them and get the most juice from the squeeze for the effort for Pilates. And please don't misunderstand my interpretation of yoga. I think yoga is very fine as well. Yoga is a little bit more flexibility based than strength based, but it definitely does strengthen muscles. The key for yoga, however, is that a lot of times it can overstress certain parts of your body and underutilize others. And so if you don't do yoga correctly, then you can find yourself in trouble. So again, you want good guidance on how to do the yoga and be very respectful of any pain. If there's a position or there's an exercise that just doesn't feel right, don't feel like you have to do it. It's your body telling you that, you shouldn't be doing this to me.
Thank you. This question from Carol Ford, the rhomboids. She says that I've had a difficulty with these over the years, and she's now 78. And anytime she works in the kitchen in terms of meal prep or baking or doing dishes, is there any way to minimize the spasms that occur during these tasks?
Well, let me talk a little bit about muscle spasms. There's different reasons for muscles to spasm. They either fatigue and the buildup of lactic acid, and then they start to cramp up. You see that with athletes, etc. If you have muscles that cramp for no particular reason, and if they stay cramped, there's usually some other trigger that's causing the muscles to cramp up. Muscles are hardwired to lock down a system when there's danger in the area. So sometimes the muscles that in our neck, upper back, in our lower back, and even our legs, the muscles will cramp because the nerve that's supplying that muscle, the squeeze, the electrical juice to that muscle is the problem. The nerve is getting irritated. So if there is a prolonged pattern where the muscles in one area just keep getting spasmed, I would definitely get it checked out to make sure that you're chasing the right problem. Because sometimes what I say is the muscles are the victim of the process, but the culprit may be somewhere else, like a pinched nerve, even a pressure on the spinal cord, etc. So you just want to be careful about just ignoring it too long and making sure that the nerves are not being compromised. We always protect the nerves. The muscles they're fairly flexible and resilient, and bones break and then they heal, but nerves don't heal well, and they don't tolerate a lot of stress. So we always protect the wiring, so to speak.
Do you recommend taking glucosamine and chondroitin?
The science has not proven or shown that it's been successful. However, there is, of course, anecdotal success in both the veterinary world with horses, and there are people who really believe in it. I think there's no physical harm by taking glucosamine and chondroitin. There may be financial harm to your wallet simply because it's expensive. I think the best way to know if it works for you is to take it for a month or two and then just stop it cold turkey and see if there's any change in your pain pattern. And if you notice a definitive change for you, then maybe restart it and see if that pain goes away. I think from the meta-analyses, from the large population studies, it hasn't really uh, proved itself, but there are those who swear by it. And as long as it does no harm to you, either personally, physically or financially, then it's fine to take.
Excellent, thank you. Um, uh, can exercise and diet slow bone density loss?
Yes, absolutely. That was the whole point of the exercise is definitely the way to go, especially weight bearing exercise. If you're a swimmer and a biker and a rower, you might be fit as a fiddle, but you might have very thin bones because you don't have any load on the bones. You're not walking, you're not stressing them. And so it really depends on the type of exercise that you do for maintaining the bone health. But like I said, the nutrition for the bones is based mainly on that calcium intake, and the calcium intake is dependent on the vitamin D to get it into your system. And that's where there's many people walking around that we find that have very low vitamin D levels, unbeknownst to them, because again, it's usually asymptomatic, but they find out they've got very low vitamin D levels, which then does not promote the calcium absorption, and then secondarily will lead to thin bones. So
Well, this is a modern day question. Can you address simple ways to address cell phone elbow, which I never heard of, and when to seek a doctor's assessment on the problem?
well, let me, I'll give you my 2 cents on cell phones. So just so you know, we do what's called EMGs, electromyography, in my office. We test nerve function, and it's a very sensitive test. And I'll tell you a little story. When we first we got a new EMG machine a few years ago, and I had the cell phone in my pocket, and I kept getting static noise on the machine, and I thought that there was something going on with the lights, the wiring in the walls, etc. It turns out that your cell phone constantly emits a signal, and you can hear it on my EMG machine, and it's actually quite disturbing because it's constantly sending out an electrical pulse. Now I think they designed the cell phone so that the antenna, which comes out, is down by your mouth, not by your ear or by your brain as much. But having the cell phones next to your head, as far as the dangers of that, still to be determined over time. That being said, perhaps the solution would be use a headset, Bluetooth headset, use a speaker, try not to put the phone next to your ear, because there's no way to hold the phone next to your ear without bending your elbow. And having your elbow bent, either with a cell phone use or when you sleep, will put pressure on, typically it's on the nerve that runs right around the inside of your elbow, called the ulnar nerve, your quote unquote funny bone nerve. And that nerve will get tethered around the bone of your elbow, and it's like pulling a cord across a pole, and it just hangs on it. And that actually may be causing some of this cell phone elbow, I would assume. The other thing that may be going on is you've got some arthritis inside of the joint. But my suggestion is, if it hurts, very wisely, just don't do that. And just try to modify what you do so that you're not poking the bear. You're not continuing to irritate it by doing, to say it hurts when I do this, and a physician's going to say, well, don't do that. And that's, it's as simple as that. So I would look for alternatives. As physiatrists, what we try to do is either fix the problem or compensate for it. Some things are not fixable. You have a stroke, etc. You lose a limb, you lose muscle, etc. Then you have to compensate for that. Other times you can kind of uh, regain the strength and change the way you do things so that it does restore itself. So it just depends on what your movement patterns are.
Here's a question about CBD. Do you recommend CBD products for pain in the joints?
We get asked that a lot. Um, the research on CBD is also a little bit scant. You will have those that are very strong proponents for it. Anecdotally, a friend of mine put together a whole book on evidence-based research for use of marijuana and CBD. And uh, there again, the CBD is typically safe, unlike opioids that can make you stop breathing and affect your, yeah, I mean, that's the main risk. No one has ever died from an overdose of marijuana, unless they jumped out of a window because they were just not thinking right. But it's really a safe product. I should say compound. The problem with the CBD world and marijuana and medical marijuana is it's very poorly regulated. You have no idea what's in the products that you buy, and even from batch to batch. So it's like the Wild West. There's really no oversight. There's no consistent um, ingredients. Some of the products may have very little CBD in them. What I tell my patients when they want to try medicinal marijuana and CBD is one, when I was president of the Boulder County Medical Society, I had a whole panel of discussion, had some experts pro and con for medical marijuana when it was first legalized in Colorado. And what came out of the lecture was, one, it was a very safe compound. Two, typically it's a 50-50 combination of CBD to THC, which seems to provide the best treatment for pain. If you go too much THC, then you end up high and partying up on the hill with the kids. If you do pure CBD, you end up, that's more on the anti-seizure, it has different type of receptors. And I think my suggestion would be, if you want to try it, I encourage people to use some type of measured dosing system. I recommend like tinctures, little drops that you can put under your tongue, rather than eating it or smoking it. Definitely not smoking it, because it can be toxic to the lungs. And even if you eat it, you might absorb different amounts depending on what your diet is and what you eat it with. But if you have a dropper that you can put under your tongue, it goes right into the bloodstream, and that way you can keep a consistent dose and know if it really works for you. I would also go to a reputable medicinal marijuana shop and talk to the owners that really stay on top of the information, that know what's going on, rather than relying on the kid they just hired last week that's out there just kind of peddling the products. So those are my two suggestions, but it is safe. The take-home message: CBD and marijuana is safe as long as you don't jump out a window or drive. But you just ease into it slowly and go into it in a very educated way. Again, finding a product which is consistently made, and the owners of these stores that have been around for a while will know what products are good.
Okay, we're going into the lightning round now. We've got to answer the questions. We've got a number that are still there, so let's see how many we can get in before in the next 4 minutes. Do you recommend taking multi-collagen powder? That's an interesting one.
Yes, I mean it's again, it's going to be safe. Most of it is just expensive feces. A lot of stuff is just going to go through your system, very costly. There has not been, again, I practice evidence-based medicine, and so there's going to be a lot of supplements and hearsay about this product, that product, etc. I usually will look for that, that statement coming from the Academy of Science, etc., that says, this actually does work. So as long as it doesn't cause you any problems physically or financially, I'm okay with it. But you just have to take these statements with a grain of salt, no matter what it is, whether it's a magic injection, a magic pill, a magic everything. Words are cheap. Marketing can say anything. There's no regulation on all this on the industry. That's all I'm going to say.
Are you familiar with blood flow restriction training? And if so, what are your thoughts on it?
Again, the idea is that you stress the muscle, and then the muscle will try to compensate and try to build resistance to the low oxygen, etc. Still to be proven.
Excellent. If you're going to start using free weights, what is the recommended beginning weights to use in your view?
Well, there's something called the 1 rep max, where there's like how much can you lift one time fully, and that's it. You can't you can't lift 1,000 pounds, obviously. But you can lift 1 pound likely, but somewhere in between 1,000 pounds and 1 pound is your 1 rep max. And when you're starting out in an exercise program, what I might suggest is if you do a 1 rep max, you figure out, okay, I can curl 30 pounds. What you might do is just start with a third of that and just say, I'm going to lift 10 pounds. I'm going to do it 10 times. All right, 10 times, and then you should be fatigued. The muscle should be fatigued, and then you can slowly build up your strength as you go. The other recommendation for weightlifting or for free weights is to do it sitting down. Do the upper extremity when you're sitting, not when you're standing, because if you're standing, you might get tired and then you might stress your back.
What's your view on the new injections, like even chicken cartilage, things like that, into the joints to prolong the replacement of those joints?
Marketing's well ahead of the science.
Okay, good. That's interesting. And let's see, we've got one more here. Where is it? It was a tingling one. I don't know what happened to that one. It was a question about experiencing tingling in the upper arms that moves forward into the arms and then down into the fingers. What's your thought on that? And what's this person likely to be experiencing?
Tingling usually implies nerve compression. That's a kind of a big danger sign. It's something you want to get checked out. You don't mess with tingling. If it's tingling because you sat wrong and your foot falls asleep and then it comes back to normalcy, that's fine. But if you've got tingling for no reason, or if you've got tingling that does not go away, that should definitely be evaluated without a doubt.
And the evaluation is with that EMG machine?
It depends. It depends what's careful physical exam was the first one, just to see what pattern it is. Maybe it's just a peripheral nerve. Maybe it's the cell phone elbow. Maybe it is from stenosis in your neck, where the spinal cord is impending doom, and if you fell, you could actually be paralyzed. So it goes anything from mild carpal tunnel syndrome all the way up to severe stenosis in the cervical spine, which has its repercussions if you fell.
Well, that was a extremely intensive question and answer session, and you did a marvelous job. Your presentation was fantastic. I know everybody on the call, we had 108 or 109 participants today, which is a huge number, and they were all very, very interested in hearing your presentation. I'm sure it took a lot away from it. So we're going to all, as a group, thank Dr. Cliff Gronseth from Spine West in Boulder for taking the time to help us understand more about this topic. And I want to wish everyone a good afternoon, and remind everybody that we have another session tomorrow, same time, same channel. So thanks so much, everyone. Have a great afternoon. Dr. Gronseth, thanks again.
You bet. Thanks a lot, Al.